Usually I was.
That was more now.
Okay, I'd like to call the Health and Human Services Committee to order, please. First item on the agenda, discussion item. Anything to discuss with the supervisor? Hearing none, we'll go right to the first resolution. Resolution amending 2012 operating budget public health. I'll sponsor that. Do we have a second? Bart? Discussion? Hearing none? Move it?
Move it back.
Okay. Any objection? Okay. Next resolution amending 2012 operating budget in accepting grant fund social services. Do I have a second? Michael? Discussion? Hearing none? All in favor?
Aye. Move it.
Next resolution authorizing Montgomery County's Medicaid Statement of Interest, Department of Social Services. I'll sponsor that. Do we have a second? Bart? Discussion? There is one item here that resolved. I met with the commissioner, and we're thinking resolve Montgomery County has completed and submitted a statement of interest to the Department of Health. That's acceptable to the members. Is that all right? Wishes of the committee?
Move it.
Move it. All in favor?
Aye.
Any objection? Hearing none, we'll move forward. Next resolution to create head social welfare examiner position, Department of Social Services. Do I have a second? Jane? Any discussion? Yeah, Jeff.
Not on the board, but
Yeah.
I just want some clarification to that. Just, we're combining two positions.
Yeah, basically this position's kind of come full circle from what it was 20 years ago, where it was combined under the title it is now, that we call it head social welfare examiner. Back in the 80s, is that correct? That's what it was. And it was a combined position where they did staff development and they also did the resource recovery, burials, and special projects. And then it morphed into a deputy commissioner position, did the same role. And then it morphed again where it was separated, where you had a staff development coordinator and a senior resource recovery person. They had two positions. And then under Commissioner Capobianco, he brought them back together to one position. However, there was a grievance filed on that because the employee was never given the pay that she was promised. So there was a grievance. They didn't want to get back into the same problem we ran into before, so we combined the positions into two, or into one, and we think that position can function that way because it has an impact. That's basically the history of it. If they're both important functions, they have to be done. I think it can be done by one person.
But there's no additional cost to us. This is just a change.
We are bringing up the staff development on a salary. We are increasing because that was part of the grievance, is that the person was doing both jobs and more and being compensated.
So the net will be an increase to your budget.
Yes. It's fully funded.
Okay, thank you.
Anything else, Jeff? John?
Thank you, Chair. Does this position currently have somebody in it?
No. It went vacant in the middle of June, and we've done 20 burials, we've done numerous estate recoveries. We're going to get buried in fair hearings if we don't get somebody. That would be my prophecy.
I heard fully funded, so I want to be clear. 100% covered. The county pays nothing. Okay. What about, yeah, good question. What about the fringes then?
Fringes are covered.
100%
52% of our salaries are
or fringes?
fringe.
Okay, thank you.
Anything else, John? All set. Tom?
Chair, I think, to be perfectly clear, the fringes are in the personnel budget.
Excuse me, Tom.
Oh, I'm sorry.
No, go ahead.
The fringes are in the personnel budget. They're not in your budget. So are those fringe benefits going to be offset in the personnel budget?
They're in the 4610
Or
and or in the 3610
or-
in our budget.
or do you add 52.3% into your budget for fringe benefits?
It's in my monthly claim.
Yeah, what you're doing is you're taking the fringe benefits to accumulate revenues to offset the cost of the salary. But the personnel budget does not get reimbursed for any additional fringe benefits.
It's covered in our budget.
You're not answering it.
4610.
You're not answering it. There will be no offset in the personnel budget to the fringe benefits because the fringe benefits are being consumed by your formulas. You take salary, agreed? You take salary,
Then it's like,
you add fringe into it, you get state and federal aid,
yes.
all right? You use 100% of that to offset the salary. But the fringe benefits are in the personnel. So just to get it straight, where it's not fully funded. The salary is fully funded.
No, the salaries are fully funded. The fringe is in addition to the salary.
Okay, but the fringe will be, well, Rich Baya will see in his personnel budget a check from you for the fringe benefits.
Yeah, because he's wondering where does the money go?
You don't have fringe benefits.
It's in our 3610.
No, you don't have fringe benefits in the social service budget. Nobody does. You will pretty soon.
In our claims to the state and federal government, we claim that fringe benefit. We get that money from the federal government. It's in our 3610 in our.
I agree, but the benefits for your employees, for all employees, are currently in the personnel budget, not in your budget. They are going to be, on January 1, the health insurance costs will be in your budget by January 1. The new fund for health insurance will be apportioning the cost of your health insurance in your fund. It will be. So at that point, then we can say that it's fully offset. Thank you, Chair. I just wanted to make it clear.
The county's budget's still about nice.
Anything else, Don?
No.
Tom?
Are we absolutely sure now that the new position, I guess what I'm asking is, have you checked with CSDA, or is the new position now going to there's going to be no issue with it?
Yes.
No working out a title, no, it all fixed?
We went to our labor attorneys, we went to civil service and state. They actually helped us craft the name.
But just for the heck of it, even though we went to our labor attorneys and those, did you actually clue CSDA and say, here's what we're doing?
Absolutely.
And everybody's good, just, because could say one thing, and, there could be another. I just want to make sure we don't have the...
Actually, this thing, because there was a grievance associated with this position, we have had many conversations.
So
Personnel
we're all on
officer
board. All right.
and CSEA, and this is basically the best that we can come up with. And I think everybody's happy with it.
Okay.
All set, Tom? Tom? Tom, you all set?
All set.
Okay, thanks. We got Shane next.
Yeah, the only thing I wanted to ask, could you do, whether it's 100%, 50%, 70% local, I don't care, can you give us the actual salary of the current position the way it was itemized? Because if we go by the two listed, they're zeroed in the budget, but could you give us the actual salary and the total salary of the new one?
You got the phone.
You don't have the new salary either?
It's, I know what the pay grade is, I don't know what the total is.
We have the budget. I
Pay
want to
grade?
say it was 35 something.
Wasn't 3670, 36,733 plus 120?
No, we've got it.
It would actually come out to 36, about 800, 900,
37,877.
37,877, and the new salary would be 12,626 on top of that.
No, that's just for the rest of this year. That's for the 2012 budget.
What about for 2013? Do you have a total?
That's not it. That's
So this,
not
this
the-
12,626 is a portion from September to the end of the year?
Yes,
So it's only for 4 months?
yes.
So what we can basically do is add 6, I can add the additional 8 months to that, and I can get the total new change?
Yes.
So that's the total price for the job then? Okay. Okay. All right, so 12,676 is, or 626 is just for 4 months, and then to make a year's salary, I will just multiply that by, divide it by 4 and multiply by 12. Okay. Thanks.
Anything else, Shane?
No, that's good.
Jack?
Okay, I want to try to get this clear in my mind, because Supervisor Stagliano said something interesting to me. The fringes are currently in the personnel budget. You receive monies from state and fed for fringes. Does that money go back to personnel, or are you guys keeping it in your department?
Always stay in our budget. It's
So what's the
always
money
been-
being used for if it's not being used for fringes?
It's the revenue lines, it's our administrative revenue lines, 3610, which is social services administrative,
So
state aid.
in essence, your revenue line is inflated by the taxpayers of Montgomery County through the fringes and the personnel line. I'm just trying to get this clear.
Yeah. Yeah, they voucher for over $2 million.
Well, if you have fringes coming back from the state and from the Fed to reimburse for fringes, and that doesn't go to the fringes line in personnel, and you're using it for something else, that tells me that the county taxpayers are paying more for social services than they're supposed to be, through the personnel line. Am I wrong, or am I right? Which is it?
Revenue line, it's part of our revenues. We budget for revenues.
I understand, but your revenues are artificially inflated because of the revenue that you're receiving from personnel through fringes. What I'm saying is that you're receiving revenue to cover fringes, and we're also budgeting for those fringes in personnel. So now, we are taxing for those fringes when in essence we're being reimbursed for them.
Yeah, but your
Bottom line, county-
revenue line is up higher than your expenditure line. So you receive it in one, it's,
Which is why we have.
I'm thinking we're overtaxing for fringes is what I'm thinking. All right, it's clear as mud. Thank you,
It'll
Sheriff.
get clearer during the budget time.
Last year.
That's part of the money that access gets back to the county every year, and not being how every year we end up having money left over, and we end up, it goes back into the county funds. That's part of the money that goes back to the county.
Then why tax for it in the beginning?
We
If
have
it's a
no
revenue
control.
line that comes back at the end of the year, why tax the taxpayers for it at the beginning of the year?
We have no
We're not
control,
taxing.
we have no control over the.
I know, we're taxing. We're the ones that are doing it because the information is given us.
personnel should lessen their, personnel should say that.
It's part of my revenue
Oh my
budget.
God.
Part of the budget.
Sean, can you shed any light on this?
Personnel,
You're not overtaxing the public. Their revenues are offsetting the expense in personnel, is what's happening.
okay.
But personnel's not getting the benefit of it.
No. The whole expense is showing in the personnel budget. DSS is recognizing revenues for that.
Has there ever been a shortfall on that line that has caused?
Well, the only point here is that there's no one that is fully paid for. That concept of being fully funded has to cease, because it's not. But it will be, you'll see it more clearly in the new year when your actual health insurance costs are part of your budget. They're not going to be in personnel. They're going to be in yours. So you're going to see actual costs, and you're going to see cost allocation based on actual numbers. All right? So then you'll see what is the net impact of your budget at the bottom. Because remember, the $2 million that you're claiming is actually coming from the $10 million in the personnel budget. Okay. It'll be more clear when the new budget comes out.
But at the end of the year, they're giving back $5 million.
No, you'll actually see what the net effect. It'll all be segregated.
What's next?
John, do you want to discuss that further in finance or anything? No? Anybody else? Wishes of the committee?
Move it.
All in favor? Anyone
Aye.
opposed? Next resolution to amend the 2012 budget and change title of vacant position, Department of Social Services. I'll sponsor that. Do we have a second? Larry? Discussion?
Move it.
I just have the same question, what is the position?
This was a position that came over from the treasurer's office as a senior account clerk. Was on our front end, the reception area. We want to drop it 2 grades to where. And that's all. We're dropping it down 2 grades. So, and then we're going to keep it as a clerk typist, so we can have flexibility with that position. So it'd be at the same level as a receptionist, basically.
So it's a vacant position now,
Yes.
we're dropping it 2 levels,
Yes.
so this is going to cost us less than what's budgeted.
Anything else, Jeff?
Great.
And when we drop this position, we won't be in jeopardy of having this person now working on a title. Because in essence, they're going to be a receptionist, or we're okay with that? Okay.
All set, Tom? And Commissioner, this $9,049, that's just for this year, for the remainder of this year, 2012. Any further discussion?
Nope.
Wishes of the committee?
Move it.
All in favor?
Aye.
Anyone opposed?
Nope.
Under other, I have no other items unless someone...
Nope.
Wrong committee. We all work committees.
Motion to adjourn?
Yep.
Barb?
Yep. Harry. Done.
Let's do it, Herbie.
Here.
Come on, Herbie.